Hey guys, see, I told you I'd be back more than once a year. So the last video that I did was basically a, hey, I'm back, here's what's been going on for 8 years, but I think this video needs to get down to the nitty-gritty of things, and that's basically what led me to get a gastric sleeve surgery and what I, looking back on it, would I do it again, blah, blah, blah. So I went to the doctor with my wife, and they told me, hey, we have these new things, they're called testosterone pellets, and we implant them in your butt cheek, in the fat of your butt cheek, and they time release over 6 months, and they elevate your testosterone level rather than a pill, which is really bad for your liver and very toxic. The shots, which make you peak and then crash and then peak and then crash, because you got to do it every week. Or the lotion, which can be really bad and transfer onto your wife or your dogs or whatever. So, which I'd been looking into. So I said, yeah, I'll try it. So I had to do blood work first, and they came back and she's like, yeah, you've got low testosterone, but you have diabetes, your cholesterol is like 200 points higher than the maximum for safe levels. Your sugars are crazy. You are a walking stroke waiting to happen. And I was not even 45 years old yet. So I started to kind of panic. Like, you know, first you're like, yeah. You know, I was walking around at 385, 390 pounds. I was uncomfortable no matter what I did. I remember trying to put on shoes and socks and being out of breath and not being able to lean over, not being able to fit into a airplane seat or be comfortable in the car. My back hurt when I walk, my ankles hurt. Every time I ate, my ribs hurt and my back hurt. And I would eat knowing that I was not doing good for myself. But I should say I was very good about trying to be on a diet. I was very good at sticking to diets. I would lose weight and then go off and gain weight. So I got to the point where I'm like, you know, fuck it, I'm gonna check into this surgery, because my sister had the lap band surgery and she lost a lot of weight, but she had so many side effects. She had to keep going back and having it reinflated, and I think she ended up having it removed and having the sleeve or the bypass. I can't remember. We don't talk. But I looked into the sleeve, and I like the idea of that better than the bypass, because I talked to some bypass people that I happen to know, and they were like, yeah, you know, we have some gas issues, and the dumping thing, they call it, which is where things just go right through you. Like, you eat and you got to go straight to the bathroom. I didn't want that. So I went for the sleeve, and it's a permanent thing. It's, you know, they say, oh, you can stretch your sleeve back out. I've been 8 years. I gained a little bit of weight back. I still throw up if I take too many, like one too many bites. I still throw up. So anyway, I got the paperwork back from my blood work, and I started looking into it, and I went online. I found Be Lightweight. I promote the shit out of them, I know, because trust me, life-changing things you want to share with people. And then I'm like, oh shit, it's in Mexico. Because I went to my doctor first, and she's like, well, to get approved by your insurance, you're gonna have to lose like 60, 70, maybe 80 pounds so that you can prove to them that you're willing to stay committed to a lifestyle. And I'm like, but fuck, I wouldn't be asking to get a surgery if I could lose 60 to 80 pounds like that. And then or pay cash, and it's $25,000. So I went online, I dug around, I found Be Lightweight, and I'm like, fuck, it's Mexico, I don't try. And then I started talking to some people who had been, and they were like, great experience, great doctors, everything about it was great. So I said, fuck it, I'm gonna do it. And I did. And you know, from the time they picked me up at the airport in Mexico to in Texas, and we drove across the border to the hospital, I stayed overnight. I went out to dinner the night before my surgery, had a steak and I drank a Coca-Cola and ate a baked potato, and you know, I wasn't really supposed to do that, so it took 7 tries to get a needle in my vein in my hand because they couldn't get it in for the IV for the surgery. But you know, once I had that surgery and I started seeing the weight come off of me, I was blown away. Like 3-4 pounds a day were coming off. Like, I had my surgery in May. In November, my wife and I went to Italy on a vacation. I fit in the seat. I was buying new clothes. I was down to like 270, 280 in like 5 months. That's crazy. You know, over 100 pounds in 5 months. And feeling better. I went and had my blood work done in January. So what, 9 months later, I had my blood work. I was no longer diabetic. I was no longer high blood pressure, no longer high cholesterol. My testosterone levels were pretty good because I had been doing the pellets, the testosterone pellets. I don't do those anymore. I should, but I don't. It was like a new me. You know, I bought all new clothes. I ended up getting down to where I'm at now, a little more than I am now. And you know, and what's crazy is my wife's like, I think your dick's getting bigger. And I'm like, really? And so I researched that, and I'm like, and it turns out I did a whole video on it, in my most popular video I've ever done. The penis size, your penis seems to get bigger because it's layered, the fat layers on top of the base of the penis. So the part of the penis that sticks out seems to get swallowed up by your fat. And so as I was losing weight, I was getting my old Johnson back. And she was like, it's definitely noticeable. I mean, she's like, is it growing? Like, what are you doing? Is it from the pellets? No. So it was a life-changing thing for me to have that confidence back, because when you're, you know, to be naked or in front of somebody or whatever, and, you know, I have some loose skin, so I was really conscious. But once I started getting my Johnson back, I'm like, I'll walk around naked in front of anybody. I don't care, as long as that's there. But, you know, if you're watching this, there's a really good chance you've either just had surgery and you're trying to figure out where you're going next, or you're thinking about the surgery, you're really unhappy, you're doing your research to try and find the right thing for you. And I can tell you, the right thing for me was getting that surgery and then sticking with it, the lifestyle change. And, you know, I've eaten a lot of bad shit since I had the surgery, but you pay for it. You're not like in the hospital for it, but your body goes, yeah, you don't need to do that anymore. And you adjust. Now, when I first got my surgery, I started watching these videos, and these people are like, I'm eating donuts, and, you know, I'm drinking 2 Frappuccinos a day, and I'm good. And I hear people say they gained all their weight back. And fuck those people. I don't feel sorry for those people 1 minute. Well, I can't eat what I want. Yeah, you can. You just eat a bite or 2 of it. But what you want to eat is what got you fucking fat to the point of having your stomach cut out in the first place. So, you know, get over yourself, move on with your life. Choose a path that you're going to live long. If you got kids, you need to live for your kids. You need to be an example. I live right next door to a family of fat fucks. And the husband's about 100 pounds overweight. The wife's 100 pounds overweight. Their kids are all morbidly